I'm David Waite from the New Zealand Nurses Organisation. 2 years ago, the Human Rights Commission investigated New Zealand's aged care sector. The resulting report made 10 recommendations to improve both the quality of care and also the conditions of work for those working in the aged care sector. Now, 2 years on, the Human Rights Commission has run a second summit to look at the progress made towards those recommendations and the work that still needs to be done. These are the issues that members of the Service and Food Workers Union, New Zealand Nurses Organisation, thought were most important for the Caring Counts Summit.
Mary Ann Bishop, Service and Food Workers Union. Currently in aged care, training is very sporadic. We rely on a lot of in-service training, and providers tend to have their own training program. What we need is a nationally recognised training program that you can transfer from one employer to the other, and it needs to be a requirement in the job that everybody actually has training, because it's actually quite a skilled job.
I think we deserve to get more pay in the aged care sector. The reason being that the residents are getting very hard to handle, and the job and the workload is getting harder every day.
Later in the day, members were given the opportunity to hear what political parties would do with the recommendations and also to ask them questions.
I would like to tell the politician we need more pay for the staff, because the staff are getting very stressed. The amount of money that they pay is not enough. And the quality of care for the elderly people, because the staff haven't got time to commit with the hours that they're given them. It's not enough, and the pay is not enough to live, especially the cost of living has gone up.
My name's Grant Brooks, and I work in the DHB sector. And I've come along today to support these aged care colleagues from NZNO. When I hear what they are paid per hour, I'm shocked. I think you would be too. Because if they worked in the District Health Boards, they'd be getting $16.93 to start with per hour, up to nearly $20 per hour after 5 years. And it's because they work with older New Zealanders who are not valued in our society, and because they're mainly women who are undervalued in our society, that they're treated so badly. And I don't think that's okay.
Hi, I'm Sue. I work in the aged care sector and have been for 19 years. And I'd actually like every politician and every party to front up and do what they have to do. We're coming into a society where aged care is getting bigger and bigger, and our taxpayer dollars are going overseas.
Mary Ann Bishop from the Service and Food Workers Union. I'd like the politicians to look at our staffing levels, because they need updating, and I don't know whether they realise, but when we're short-staffed, it's the residents that actually miss out, because we actually have to cut cares, and I don't think that's satisfactory.